Our topic today is pancreatitis. There are mainly two types of pancreatitis: acute pancreatitis and chronic pancreatitis. So, what is acute pancreatitis? Acute pancreatitis is a sudden and short term inflammation of the pancreas, and most common cause of acute pancreatitis is gallstones blocking the pancreatic duct, and the second most common cause is heavy alcohol consumption. There are some other causes as well, but these two are the most common causes to remember. Now, let's review the symptoms of acute pancreatitis. So, there will be sudden severe abdominal pain that may radiate to your back, nausea and vomiting, fever, rapid heart rate and shallow breathing, and tender abdomen. So, for diagnosis, you check pancreatic enzymes, which are amylase and lipase, and they will be increased. And in imaging, you can do abdominal ultrasound or abdominal CT. For management, you give IV fluids, keep the patient NPO, that is nil per os, and give some pain relief medications like morphine. And when the symptoms and complications subside, you give additional treatments to address the underlying causes, for example, ERCP to open the blocked bile ducts, and cholecystectomy for gallstones if they are the cause of pancreatitis. And you can start some alcohol addiction program in case of excessive alcohol abuse that caused the pancreatitis. Now let's discuss chronic pancreatitis. Chronic pancreatitis is a long-term inflammation that gradually worsens over time, and most common cause of chronic pancreatitis is alcohol abuse. And there can be some other causes as well, like hereditary pancreatitis or recurrent episodes of acute pancreatitis that eventually leads to chronic pancreatitis. But to remember, the most important cause is alcohol abuse. Let's review the symptoms of chronic pancreatitis. There will be persistent abdominal pain, which is usually less intense than an acute pancreatitis but ongoing, indigestion and discomfort after eating, unintended weight loss due to malabsorption of nutrients, steatorrhea or fatty stools indicating poor nutrient absorption, loss of appetite, and development of diabetes because the pancreas cannot produce insulin effectively. For diagnosis, you can check pancreatic enzymes like amylase and lipase, but they may be normal, making the diagnosis difficult. You can go for abdominal CT, which shows calcification and atrophy of pancreas. And then you can also order some stool tests for fecal fat content. Management of chronic pancreatitis is different from acute pancreatitis. For chronic pancreatitis, because the pancreas is dying and not producing its enzymes or hormones anymore, so you will have to go for pancreatic enzymes replacement, that is amylase, lipase, protease replacement, and you will go for insulin replacement, and then you will do some lifestyle modification like low fat diet, increased hydration, stop smoking. And one of the most common complications of chronic pancreatitis is pancreatic pseudocysts, which should be drained endoscopically. So here is a comparison between acute and chronic pancreatitis in terms of pain, duration, and complications. For acute pancreatitis, pain is sudden, severe, and can spread to the back. For chronic pancreatitis, pain is persistent, ongoing, and often worsens after eating. Duration: acute pancreatitis is short term, symptoms appear suddenly and are intense. Chronic pancreatitis is long term, symptoms develop gradually and persist. Complications of acute pancreatitis. Acute pancreatitis can lead to serious complications like infections and organ failure, whereas chronic pancreatitis leads to long term issues like malnutrition, diabetes, and an increased risk of pancreatic cancer.